Okay.
Well, hello everyone. Thank you so much for being there with us today on the Health Day. Thank you for taking the time. We know it's a bit late here and both in Spain, so we are very pleased. We are in the 10th anniversary of the Paris Agreement. We are in the 30 COP, and it's a personal opinion, but I think we know what we have to do. The real gap is how can we go further, faster, and fairer, no? So today with us, to try to challenge this gap, we have a panel of experts, of 4 experts. We are actually missing one, but don't worry, she will come. So let me introduce them to you. In order, you have Guillermo López Ginés, who is, sorry, I'm trying to switch to Spanish to English, as a counselor for climate action of the metropolitan area of Barcelona. Thank you for being here, Guillermo.
Thanks for inviting us. It's a pleasure to be here.
Then we have Diana Picon Manari, espero decirlo bien. Thank you, Mariana. You are the International Climate Senior Director in Healthcare Without Harm. You will tell us more about Healthcare Without Harm, so I'm not spoiling anything. And then we have Jerry Ejikmans, Director of Social and Environmental Determinants for Health Equity at the Pan-American Health Organization. A long title for an important one, so thank you thank you so much for being there with us today, Jerry.
Pleasure.
And I am Philippine Menage. I'm working in a Spanish foundation called ECODES, working with the decarbonization of Spanish health sector. And before going to the question and the panel, because we want to learn about the real decarbonization and what is healthcare system resilience, I just want to thank especially the Spain Health Ministry for the invitation to this panel and for launching this event. The ministry couldn't be there today with us, but thank you so much, and we are really happy to collaborate with them. So let me go in the question. We are missing one panelist, Elena, that I will introduce later. So I'm going directly to you, Jerry. You are from the Pan-American Health Organization, working with America's a really diverse region in terms of economic, social, and also climate impacts and responsibility. So how do you address these different realities within your climate strategy and resilience strategy at the Pan-American Health Organization?
Thank you. Thank you very much. You hearing me? Yeah. So, important question. The Pan American Health Organization, as you probably know, is the regional office of the World Health Organization, but it also has an independent status. This is a health organization that's over 120 years old. So we have, you cannot hear me?
In the headphones, through there.
Continue? Okay. Good. So as you said, the Americas, the region of the Americas is very diverse. Economically, you know, we have countries like Haiti on the one hand and the US on the other hand. We have within countries huge diversity, you know, and particularly huge inequality. The Americas are the most unequal and equitable region in the world. So obviously, everything we do, we need to do it with a particular focus on specificity, on the situations of the people we serve in the Americas. So in that context, we look at vulnerability. We look particularly at how people do not reach, and why do they not reach health services? What are the access barriers to those services? And that's where we have we work particularly on identifying those and how do you overcome them. No? And that has not only to do with health. It's loud, so loud in my ear. Yeah.
Very loud everywhere.
It's better now? Okay. It has to do not only with access to care, but also access to health. So there's a very strong focus also on health promotion, on addressing social determinants of health, on going really to those elements that make sure that people get access to health as is necessary. And particularly when it comes to climate change, this is of course extremely important. You know, the vulnerabilities are really defining what the impact is going to be on the health of people. No, not only on the individual health, but also what happens, you know, with the health services. Do they still stand after a hurricane, like we just have seen in the Caribbean? You know, and what kind of services do people have access to, depending? Do they live in the Amazon? Do they live in the big city? And then again, depends if they are in the suburban poor area or they are part of an elite. So these things are extremely important when we devise our policies. And we have, and I can talk a little bit more about that, we have several policies that do focus on those different realities in the region.
Thank you so much, Jerry. I just have a follow-up question. I hope that you will talk louder and louder. You told us a lot about the resilience and the vulnerable people, no, in Americas. But Americas also have like big emitters, countries with a huge responsibility for their climate impact, such as Canada and United States. So how do you tackle also this mitigation part and try to put some resilience in this mitigation?
This is crucial. Last year, in the regional conference of our ministers of health, we launched a policy on climate change, health equity, and you could immediately, like in any other caucus, see the positions that countries are taking depending on what side they are. Are they the ones who are, you know, polluting more? Are they the ones who contribute more? Or are they the ones who are on the receiving end? And then you see, of course, those very clear blocks, you know, Caribbean, North America, and then within South America, huge diversity also. So, of course, we work mainly through our ministries of health. Yeah, so they are the ones who come to our meetings, also mayors, etc. But we don't necessarily work directly with industry, but it is, of course, the position of the healthcare sector that then, you know, expresses the interest of the country. So these are things, you know, that play out and that do define in the end, and this is both the WHO and the Pan American Health Organization that are member state organizations. How far can you push, you know, here, you know, with the agendas if you have vested interests? And very often also production in Latin America is related to state-owned companies. So that is also something that's important to take into account. So it's a negotiation, like everything, and sometimes we have a little bit more success than other times, but it's a complex situation.
Thank you. Love the idea to push countries, no? That's the work that you are doing on your everyday basis. And also the idea to break these different silos, different blocks between regions and sometimes perceptions, and try to find this common narrative. So going from one region to another, we're going to talk a bit more about Spain right now. Before going to you, Guillermo, I just want to share some data from the Spanish Health Ministry Observatory on Health and Climate. So I think it's a very important number that in 2023, this health observatory registered more than 3,000 deaths attributable just for the excessive temperature at national level. So more than 3,000 deaths just because of heat in Spain. And I think it's a crucial number to understand that we are not just talking about global north, global south, but we are talking about a global phenomenon that is impacting Latin America and Pan America just as it is impacting Spain. So Guillermo, finally going to you. You are working in the metropolitan area of Barcelona. So as a municipality managing essential services, no, like transport, also water, coastal impacts. All these services are directly affected by climate change. I know that in Spain you don't have the direct competence capacity to talk about health. The health is going at a regional level and not at municipal, but in the end you are impacted by it. So how do you see your role in protecting this public health, and how do you involve at health sectors, stakeholders in your management?
Yeah. So obviously, climate change has a direct impact on health of our citizens. But before going deeper on that idea, let me provide a little bit of context from where I come from. As you were saying, I'm part of the government of Barcelona's metropolitan area. That's the 36 municipalities around Barcelona. It's 3.4 million people, and we have a budget that a little bit lower of 3,000 million euros, what Americans call 3 billion. And from the metropolitan government, we take care of different areas, from urban planning, mobility, many different areas. And obviously, we take into high stakes the health impact. And I'm going to provide an example. Now we are working on an air quality plan. And before we decided which actions we want to take care, we were making a study of how all the air quality is, all the population of those 36 municipalities are exposed to the different contaminants, to different pollutants. And we are aiming for 2030 to comply with the EU new limits. And so the first thing we're taking, because that empowers us to take decisive and impactful actions, is to measure with health impact is having on our citizens. Another example we were studying is that the access to fresh food in the different neighborhoods of our cities. We found out that nowadays, with more supermarkets and with less grocery stores, there is areas and in these cities around Barcelona where it's almost impossible to buy fresh food, and that also impacts directly on the health of our neighbors. And the last example that we were studying, because it's also one of our governance areas, is urban planning. And we were studying how the different schools and the school surroundings in all these cities are, and how that affects the health of the kids.
Thank you so much. So interesting to see how you can manage more than a 4 billion people city. I think it's a very important number to take into account what kind of services are we talking about. Apart from the study, are you trying to include more the health sector into decision making?
Yes, for example, for the school environments, we've been meeting and working hand by hand with with the doctors taking care of kids, because they are aware of how pollution, how noise, and how not having access to green spaces affects kids. Nowadays, we have problems of kids not having enough mobility and not eating properly. So it's super important, because at the end it empowers us to take action when it's not just when it's science also who is telling us to take action.
Thank you so much. Yeah, talking about noise, we are very sorry about the situation, but very happy to see so many of you with us. And please keep your question, keep your intervention, and we will be dedicate time to have a direct conversation and not just a panel one. So as EcoDesk, we are working a lot on mitigation because, well, we're working in Spain, and Spain has a lot to do on mitigation, and to do so, we have a special collaboration with Healthcare Without Harm. And now I think, Diana, we can talk a bit about Healthcare Without Harm. You can spoil everything, and you can tell us, as a Waste to Zero partner, so Waste to Zero is an initiative about mitigation. How do you make health systems fairer, faster, further on mitigation? And also, what are your key action, and how do you involve your stakeholders? A lot of questions, sorry, Diana.
That is a lot of questions. Okay, we're going to try to dissect that a little by little. And I guess the first thing to talk about is what is healthcare without harm. And as you said, we're a non-profit organization based in the US, in Europe, in Brussels, as well as in Manila for the Southeast Asia region. And we've been around for about 30 years working with the health sector to do that, have a healthcare sector that does not cause harm. And that means at the beginning doing work with chemicals and toxics, and we've continued that work, but we've been engaging on climate now for the last about 12 to 15 years. And we do that through a special network of hospitals that we created, we helped develop, and it's called the Global Green and Healthy Hospitals Network. That Global Green and Healthy Hospital Network now has about 80,000, almost 80,000 hospitals and health centers worldwide in over 80 countries. And it's been an amazing thing to see how the movement of the health sector, both in terms of private and public hospitals around the world, have really joined this movement on climate, and because they see what climate does to patients, what climate does to communities. And we've been working with them now for these last few years to make sure that they have the right guidance, the technical assistance, the tools, if you will, to measure and to actually act upon that measurement of their greenhouse gas emissions. In terms of Race to Zero, we came to be the sector lead for Race to Zero, and that was about 5 years ago. And we actually announced today a really great milestone, and that's our 100th member of Race to Zero, the Race to Zero campaign, which happens to be a hospital here in Brazil, the Hospital do Coração, and we are very happy to welcome them, and this is a really great thing for the movement. That means that we have about 15,000 hospitals worldwide in about 28 countries that have pledged to have their emissions by 2030 and to reach net zero by 2050. These are not hospitals that are in the developed world in the north. These are hospitals everywhere, and more we see a lot of interest from hospitals in the global south. We have an amazing also member who is going to be doing a lot of this work in the state of Kerala in India, and we have been working with, in Spain as well, with several subnational entities. So how do we do the Race to Zero? We provide, as I said, some of these tools and guidance. We've provided guidance particularly around planning and around baselining and ensuring that these health institutions have the ability to report, because that is the basic tenet of Race to Zero, is that you have to be public about your commitment and about your reporting, and that you're accountable to this goal. When we talk about resilience, though, this is an interesting one, because we often do not talk about another initiative that we have, that is Healthcare Climate Challenge. So Race to Zero, let's just say that those are the most ambitious hospitals in our network. A more basic interest initiative is the Healthcare Climate Challenge, which has both adaptation and mitigation in it. And we're going to be seeing some changes to it, I think, next year. Very exciting progress, because we've endorsed the Belém Health Action Plan. And if you've heard about it today, the Belém Health Action Plan really focuses on the adaptation to climate change. And in terms of health systems, we want to make sure that those adaptations happen not only in the hospital, in the infrastructure, in that building, but also that those adaptations take into consideration the vulnerabilities of the communities that those hospitals serve. And in order to do that, we want to make sure that that is more integrated. What does that mean? We have decided, we've created this world where mitigation happens here and adaptation happens over there. And for some reason, those two worlds apparently don't speak to each other. And we are here to challenge that. We're here to say, no, it can be done. We just need to find find a way to do it. And in the same way that we've done this Race to Zero and this Healthcare Climate Challenge, we're going to start working with hospitals to make sure that they have the right guidance, to start looking at what are the things that they need to consider for adaptation when they're doing their plan on sustainability and low carbon, and the other way around as well.
Thank you so much, Diana. Very interesting, this idea to challenge the separation between adaptation and mitigation. And that's why I'm going back to you, Jerry, talking a bit about how do you break the two, no? These two parts of action. What do you do in the Pan American Health Organization to promote adaptation as well as mitigation?
Thank you. So we have, as I mentioned last year, countries in the region adopted a regional strategy on climate change and health equity. So this strategy has, or this policy has 5 lines of action. One has to do with adaptation, which is of course extremely important in the region. We already need to be ready, not only to make sure that hospitals keep standing after a storm, but also that our malaria programs, our dengue programs, our chronic disease programs adapt to what is already here. And this is a big challenge because many ministries of health still do the same, and they don't take into account the new realities. Now, another line of action is around mitigation. And some of those things are very close together. Of course, we know that the health sector also contributes, and depending on the development level, between 5, 8, 10% of the greenhouse gas emissions. That's the sector itself. So we work, and also with partners like Healthcare Without Harm, on this reducing the greenhouse emissions. But at the same time, we're also looking at, what can happen in cities. What do we do? The creating of green spaces, the creating of active transport, which has this win-win situation, where people not only, first of all, we produce less pollution, but at the same time, people stay healthier, etc., etc. So that's the other side. So some of those are very blurred, and adaptation is also what's very critical. Sometimes the idea is that when you do too much mitigation in developing countries, it's going to be a problem because we have already a problem with access to healthcare. So if you put a break on the health sector, some countries feel that means that they cannot give sufficient access to their people. So this is a real issue that was discussed during our development of our policy. Of course, other lines of action have to do with community participation, civil society engagement. Without the community, particularly in our region, indigenous peoples, Afro-descendant populations, but also migrants, also informal workers, people homeless, they need to be heard, and their solutions need to be, co-designed. So again, this is both sides, both adaptation and mitigation. And then, of course, we need data, evidence, to inform all those policies that come with that. And then the last line that our ministries insisted on is on health financing. It's not so much that we finance, but we can support in looking for the resources that are needed to have the health national adaptation plans have health on the agenda. Because this is still, even though we have come far compared to 5 years ago, with health. But if you look at many of those, the current
NDCs.
the NDCs or the NAPs, health is very weak. And of course, then you don't attract resources. So this is some of the things that we're doing in that regard.
Thank you, Jerry. And now I'm going back to you, Guillermo. Maybe you know Héctor Tejero, who in Spain is an advisor to the Spanish health minister. So he's always saying that we need delicate decarbonization, thinking about how can we mitigate but put people at the center of it to enhance resilience at the end. So, when we are thinking about this intersectional approach, I want to ask to you, what do you think about, what can you share about the work you're doing, and maybe share some examples of resilience that's going on in the metropolitan area of Barcelona? No, I think not.
Can you hear me? Yeah.
Yes.
So yeah, one of the main projects of resilience that we are building in Barcelona's metropolitan area is our metropolitan network of climate shelters. There is we provide safe and cool spaces for people during the extreme heat events. Some events that we are getting more often and often nowadays, and it's 600 shelters mainly on public spaces, public libraries, sports centers, spaces that we provide for free access, and normally they have AC. We use also parks, but we make sure that those parks have the conditions to be climate shelters. And nowadays we have 600 shelters around the metropolitan area, and that allows us to the 80% of our citizens to have one shelter in less than 10 minutes walking. And it's also very, very interesting how we developed this network, because before we did it, we created a metropolitan vulnerability index. So we looked forward for those neighborhoods where people has more needs of those services. And also we took care, at the end it's not just of having the name and having the network, it's the important thing is how you communicate and how you get access to the people that really need it, and also that it works when most of the times, at least in Spain, it's through summer months that we have the heat waves, and many of these spaces normally are closed, or it happens the same on the weekends. So the challenge there is that they are open, that the people who normally are in this public library, on these public buildings, know how to react on these situations, and also that the support network that we have for old people and for more vulnerable people can communicate when this needs to be activated. It's like we need for them to know that they need to drink more water, that they also have the opportunity to go to these free spaces that many of them cannot afford to go to the cinema or go to a mall to get a cool space and to chill for a few hours. So we think it's from the public space that we need to provide this service.
Thank you so much, Guillermo. I think you are not facing enough the innovation that are these climate shelters for Spain, because actually, if I'm not mistaken, Barcelona is the first city in Spain that put these climate shelters in 2019, is it? So I think it's very interesting to see how you were at the front runner of the resilience in Spain. And when we were just talking about mitigation, and we were not thinking about adaptation still.
And it's funny to notice that when this started, it was questioned for a lot of people. They didn't find the need, but nowadays that, especially where we are in Barcelona, in all the Mediterranean area, that the climate change is more accelerated. It's like studies says like it increases at 20% faster than in other areas. The increase on temperature is very clear. We had through August the most extended period of heat ever, and obviously these spaces are needed.
Thank you so much. So I think now we have the time for some questions, interventions. We will be also interested to hear more about you, to use this space to connect with what you are doing, what's the context maybe in your city, country, or initiative. And we have some mic for you if you want to participate, to take the mic. If not, we can just speak over and over about the same thing. No one? You don't have any intels to share, any impressions maybe about? Thank you so much.
Thank you so much. Actually, maybe I'll go this way. I wanted to ask Diana how she thinks that this race to zero work can evolve, and how do you see that this is connected to the Belém Health Action Plan?
Thank you for that question, Eric. And I think partly is that we give the option, and I think that actually several of our Race to Zero members are already thinking about adaptation and already planning for it. What we want to make sure is that they have the right set of tools. WHO has developed tools at the health facility level. They have to be contextualized to that particular area, and we are trying to do that actually with some of the members. So we're starting to advance on that work in the next few months. Will be important as part of the Belém Health Action Plan. We want to make it broader though, because Race to Zero is our top tier of membership in the sense of they are the ones that are the most ambitious. But we have a whole lot more hospitals in the network that I'm sure will be very interested in doing this. And as a matter of fact, also thinking about whether that might be the entry point into the network, not just the mitigation side, but also the adaptation side. So I think that's a way in which we can move the needle, in which we can also operationalize in a health facility level the Belém Health Action Plan as well.
Thank you so much. I hope it answers to your question. I think this morning also they were talking a lot about now it's a time for implementation at national level. So it's not just about a global initiative. You have to really take it into your country to see with your national legislation and to start working on it. So yeah, I think it's a bit of an answer.
And perhaps, Philippine, if I may add, I know that Elena is not here, but Elena was probably going to talk about ATTACH and the Alliance for Transformative Action on Climate and Health. And since you brought up the country stuff, the country level work, I know also that Gary and the Pan American Health Organization are working very closely with WHO on this, and as we are, because we are partners of ATTACH, we're members of ATTACH. And there has been a tremendous amount of work since the development of ATTACH to be a learning platform for countries who are working with each other, helping each other based on what their experience has been. We have a few countries that are kind of ahead of the pack in sustainability and decarbonization. We have others that are also ahead of the pack on adaptation. And to try to gather their knowledge, to share it with the rest of the countries, that has been an amazing point that ATTACH has brought to the world, really. And us as members, what we're trying to do is also provide that technical assistance. It has been in the way of task teams that we call, so providing guidance. I believe that tomorrow is ATTACH Day, so if you are going to the Health Pavilion tomorrow, you can also see a series of events that will talk about guidance that has been developed in the last year. We are also providing technical meetings that will bring some support. Clinics. We're going to be having some clinics for countries who want to establish action plans, and depending on their priorities, we'll select different topics. So there's a lot of excitement around what we can do at the country level as well. And I am sure that, Gary, maybe you have something else to add to that too.
Yes, thank you. I think these are some very important points. And we also need to look at our healthcare workforce. So that's one of the other things we're doing. You cannot talk about resilient health systems if you don't have healthcare workers who understand and that can drive that change that is needed. So, for example, we have online courses where we have already trained more than 12,000 healthcare staff in the region, to be part of that movement. And I think these are things that are also extremely important. Maybe there's one other example that I want to mention is what we call our smart hospitals. So because, as you know, the Caribbean particularly is a region that's plagued by hurricanes. The hurricane we just saw, also the Philippines, but the one that just passed to Jamaica, Cuba, Haiti, has affected. It's the biggest one we've had. Last year we had the biggest one ever. So every year we have those terrible new records. Yeah. So you need health facilities that stand after a hurricane. So we have this initiative that we've been working on for years called Smart Hospitals that started with resilient health hospitals. They would still be standing, but now they're also green and they're intelligent. So that's the three elements of those smart hospitals. And when you looked at Jamaica, the area that was so destroyed, the three smart facilities that we had were still standing after a hurricane. So these are things that are really impactful, and they could, receive the people that needed it. There was no access to nothing in that area until a few days ago. And so these are the things that also, are happening on the ground in the countries.
Thank you so much. So inspiring. Yeah, please go
Yeah,
ahead, Guillermo.
Just as a closing statement from my side, I completely agree that this COP is the COP of implementation. It's the time now for states, but my call here is also important to count with local administrations like ours, because at the end it's us, the ones that are creating the different programs, and obviously climate policies are all about the earth health, and they need to work out on that sense, but they will not work if they don't count also and benefit the health of the people.
Thank you so much. Thank you so much for everyone for being there with us today on this Health Day. Thank you for our panelists. It's a shame that Elena couldn't come in the end, but I'm guessing it's a high moment. Maybe you can catch her tomorrow at the Health Pavilion talking about Attach, so that you can know more about this health global initiative with countries. Just very pleased to be with you. Just to recall that Health Day should not just be a day. We need health in every sector, in every policy, in every moment, in every negotiation, and I think that will be our closing call for COP. Just let's spread health in everything for the next week of negotiation. Thank you.